Hi, Dr. Rudy Kachmann. Welcome to the Kachmann Wellness Talk. This is going to be very interesting, as this illness I'm going to describe can affect any one of us. And this is a vascular disease, which is really heart attacks, strokes, for example. We have, as you know, this heart that's pumping about 3,000 gallons of blood every day, a real hard worker. You know, it's not beating, I guess we're not around. These blood vessels, which occupy so much mileage in our bodies, are especially affected, for example, by blood pressure, by diabetes, and there are about 1.5 million heart attacks a year in the United States, 1.5 million. About 500,000 of those die. 50% of those are unannounced. In other words, no previous chest pain called angina. The patient just grabs the chest and die. That's half of the people that die from vascular disease. So you can see if you have some disease hidden in you, you don't know about it, it's been tested, you just die like that. It happens to people, 30s, 40s, 50s, some younger than that. And one of the big ones, frankly, is what's called metabolic syndrome, where we have abnormal fats in our blood, abnormal blood sugars. It's even 15 years before pre-diabetes, and our vasculature changing. They have found some streaks in the blood vessels of children who are eating wrong. Yeah, too much sugar, bad fat. Yeah, that died from an accident. They see some streaks. And when the soldiers that died in the Korean War, they autopsied the Korean soldiers and the American soldiers. And you know what? The American soldiers almost all had fatty streaks on the arteries, the beginning of plaque, atherosclerosis. Yeah, and it's what we're eating. They're eating different food. They're eating more of a vegetable diet, and we're eating much more meat, for example, and fast food, high sugar diets. And we're getting vascular disease at a very young age. I'll be posting on YouTube a 1-hour show on this starting this Friday, but I just want you to get a taste of it. I'm going to show you the covers of 3 different books, because you must gather some knowledge when vascular disease is so common, especially the type 2 diabetics. Half the people in this country are diabetic, type 2 diabetic. And they get, what's the first symptom many times? High blood pressure, the beginning of vascular disease, unannounced heart attacks. Incidentally, angina, the pain you get from heart disease in women is different than men. Yeah. So listen to this. In a woman, it can be on the right. So any pain between the pubis and the ears in a woman, many times accompanied by some nausea, say it can be angina. It can be pain in the axilla. It can be pain in the right arm. While in men, most of the time, it's in the ear, or the jaw, or the left arm, the left hand. So remember, in a woman, angina can be right or left. And I saw some patients, even as a neurosurgeon, where that was the case. And it could easily be missed. A lot of people don't know angina in a woman can be on the right side. An excellent book, and there's hope. If you're of a reasonable weight, eat say 70-80% vegetables, maybe at most meat 2 or 3 times a week, turkey, some chicken or something, you probably won't get it. Exercise a little bit, and get your blood tested very, very early. And I mean the diabetics, the pre-diabetics, and even the ones with something called metabolic syndrome before pre-diabetes, where they look great, but their blood figures are off because they're not tested properly. So you need to gather some information. A book I'd like you to consider looking at, End of Heart Disease, Dr. Joe Furman. Dr. Furman's a friend of mine, and excellent book to read. Half of it actually is recipes, so you read 120 pages, and you'll be probably all you need to read. How to prevent, stop, and reverse heart disease. For example, when a lot of people have heart disease, the first thing they're talking about is angioplasty and heart surgery. Actually, it's not that effective. it doesn't remove all your disease. People think they've had coronary bypass surgery and the disease is gone. No, they just got them past this little episode. The disease is still there. But if you start eating correctly, exercising correctly, the disease will go away as fast as a few weeks. That's been proven. That's been proven. So this is a great book. Another one, Dr. Esseltine, at the Cleveland Clinic, he still works there today, who teaches mainly a vegetable form of eating. If you have way advanced heart disease, for example, you can reverse it if you follow his program. But you should read about it or watch my follow-up YouTube shows where it'll explain that much more extensively. And the last one, they're all slightly different, but not that much difference. A 30-day heart tune-up by Stephen Masley, also excellent to read. And all three books have recipes in them even. So you need to gather some information. For example, suppose now you have had a heart attack or two. You got to read these things because it is not brought up by the medical community. This is full of science. And the first thing, generally, he issues a prescription or let's do an angioplasty. There's certain indications for it, and they can be life-saving. You have unstable angina or had a terrible chest pain, it's not going away more than 30 minutes, you may need angioplasty right then as an emergency. Okay, I'm not arguing with any of that. But generally, if you see the cardiologist, they don't bring this up. I know that. And if you do, because one of the books is written by a cardiologist, okay? But I want you to gather information and follow the recommendations of your doctor. No doubt about that. I'm just trying to educate you, okay? And then look at our follow-up YouTube shows, which are over an hour, and explain all this in detail. Thanks for watching this post. I mean, I'm trying to save your life. This is very common. We all know somebody that in the family that died of heart disease. We all do. And I don't want it to happen to you because we love you. Thank you so much for watching this post.